Hi, and welcome to the School Health Educators Podcast, where we discuss health education and how to best teach health ed in the K 12 setting. Hi, and welcome to the School Health Educators Podcast. I'm your host, Lori Reichel, and today we're talking about national standards. Specifically, the national standards that were created by the National Consensus for School Health Education. To help explain what these national standards are about are two people, Marlene Tappy and Beth McNeill. Thank you so much for being here today. Would you like to just say a quick hi to our audience?
Well, I'm going to go with howdy because I'm from Texas. So howdy to the audience.
And I'll just say hello.
Do you mind explaining a little bit about who you are and what your background is?
Sure, I'll jump in and go first. So I'm Dr. Beth McNeill, and I am been around the block for a while. This is my 40th year in education. I started teaching public school. I taught health and life science, and then went back to school and got my master's in educational administration and really focused on curriculum development and the art of teaching. Um, from there, I kind of worked through and ended up coordinating a teacher certification program in health for many, many years, and then progressed to get my PhD in health education. I'm pretty much dedicated my entire career to working on the pedagogy for health education so that we can have good quality health for our students.
Wonderful. And I love how you added art of teaching because
Yes.
it is an art.
Yes.
Thank you.
All righty. And like Beth, I started out my career as a teacher. I teaching health and physical education in one of the tiniest schools in the state of Minnesota. And then after the GAT, went to the University of Illinois and got a master's and PhD in school health ed and health and safety studies. I've been involved in higher education, was involved in higher education for about 40 years. And then now I'm retired, but am continuing being actively involved with initiatives related to the National Consensus for School Health Ed. I had the opportunity, the thrill, the joy to be able to work on all three of the national standards committees. And I also had some really the great opportunity to spend time working with individuals with the Centers for Disease Control and Prevention. Along the way, I discovered this professor in Texas named Beth McNeill. And what was really fun was to go to conferences and listen to her students talk about the standards and their application, etc. And so, like Beth, teacher education has been at my heart and soul. For most of that time, I've been in higher ed, and Beth and I are kind of two peas in a pod.
Kind of nice having, when your colleagues are buddies and like-minded, it sure does make for a positive work environment. So I hope every one of you has a P for your pod like I do. Hey, Lori, before we get too far into your questions, I was thinking maybe we could take a look at just an overview of the consensus standards. And so
Absolutely.
we have a website. If you don't mind, I'm going to share my screen,
Sure.
and I'm gonna tell you this is not a formal presentation. I certainly don't want that to be that way. This is a presentation deck that I have, and so I'm going to skip through several of the slides that don't need to be talked about. But I think it might be nice for your viewers to kind of have an overview of kind of where we are and where we're going and how we got to this point.
Remember, folks, if you're listening in, if you have a chance later on to watch this episode on the School Health Educators YouTube channel, please do, because you'll be able to see this PowerPoint that both Beth and Marlene put together. So remember to do that.
Super. So really what I want to point out here is this website right here. It's called schoolhealtheducation.org, and then I already have it linked to the actual standards. When the consensus group got together, one of the things we were very, very adamant about was we want to have this resource available and free to our school health educators. We don't believe anybody should have to pay for standards. And so there's a dedication to that. The standards are what's really why we are so prideful about these standards is they were put together by what we call a consensus group, consensus organizations. And that means that we had representation from 6 different professional health organizations who all sent people to the table that said, this is what our students need to know, believe, and be able to do to be healthy citizens when they're adults. And so by making sure that we had representation by everyone, we wanted to make sure we had that consensus. As a matter of fact, the process for revising the standards was quite rigorous. We designed and sent for review, and then it went for public review. We had over 500 comments on the standards before they were actually finally released. So we feel very, very prideful about the quality. And what we also are very excited about is that in the standards, we have followed the format and dedicated ourselves to the doing of health education. So when you look at the layout of the standards, there are 8 standards. The first standard is, of course, the student's comprehension of functional health knowledge, information that they can use so that they can perform health behaviors. But only one standard is dedicated to that knowledge component. The remaining 8 standards, so 7 others, are all totally focused on building skills so that you can perform healthy behavior. So we're looking at analyzing influences and being able to use your health literacy skills, being able to implement healthy practices, communication, decision-making, refusal skills. All of these are skill-based standards, and they really help shape health education into being an active role on the part of the student instead of just to sit and get and learn the statistics. So we're super excited about the layout. And Marlene's going to go into a little bit more depth with you about the actual structure and layout of the standards and what was different. But before she does, I just kind of want to pop and show you I'll show you this one. That each of the standards have been divided out by age brackets, as they always have in the past. But the beautiful thing, if you look really close at these standards, is there's such a tremendous level of scaffolding that occurs. So a student learns a basic skill early as a child in up to 2nd grade. And so maybe it's identify. And then when they get to up to 5th grade, they do more discuss or arrange, or they do more application based. You're going to see the standards are going to progressively move the students through Bloom's taxonomy so that by the time they're getting into 12th grade, they're doing more advanced level health skills, which is going to empower them to be successful with their health as adults. And so I'm going to shut up now and let Marlene talk.
Alrighty. Beth, since you've got the screen, will you please go backward 1, I believe? There we go. As Beth mentioned, that the first standard is focused on what students know, and that's been the case for the standards throughout the history of the work of the National Consensus. One of the important things that we really wanted to emphasize, though, with Standards 3 was that making sure that people realize that students need that functional knowledge to be able to perform those health-related skills. For example, the benefits of not smoking, that's a reason why to avoid. It's an advocacy message in Standard 8. And it certainly factors into pros and cons when you're talking about decision making, etc. And so what we really want to make sure is that students need that foundation. We're not dismissing it, but we're also recognizing that we need that as we apply the skills. So that's one really critical thing. Okay. Um, some of the significant differences between overtime with the standards, and especially within Standards 3. Standards 3, the standards themselves are very similar to what was Standards 2. So if you, at some point in time, learned about the second National Health Ed Standards from the Joint Committee on National Health Ed Standards that were published in 2005, the standards are essentially the same. The bigger difference is that we worked really hard to make sure that we had more specificity and progression and skill development embedded within each of the 7 skill standards. And so we carefully revised, re-looked at those performance indicators. The other thing in Standard 1, those of you familiar with, and if you're not, please go to the Centers for Disease Control and Prevention's website and look up the Health Ed Curriculum Analysis Tool, and it's there. And you're going to that website is important. We carefully analyze the knowledge expectations because you'll discover if you look at the CDC tools, the National Health Ed Standards are there, especially in the Health Ed Curriculum Analysis tool. And so Standard 1 is designed to line up with the knowledge expectations, which are in the Centers for Disease Control and Prevention's Health Education Curriculum Analysis tool. So just as a comment that way. So those are the major things that we did for Standard 3, but we really tried to make them more teacher friendly, okay, and making them more specific so that you could see a logical progression between. The other big changes that have come about are things that we've done, and Beth maybe wants to mention this, is that not only did we focus on really revising the performance indicators, we also gave teachers guidance up front about how to teach a skill and some things to keep in mind while we're teaching that skill. Over time, we've had the opportunity to tweak that a bit. And so Beth and I and Kathleen Middleton, another member of the Standards Committee, we created a document called Teaching Health, Skills-Based Health Education. And within that, we carefully tried to identify even more specifically the skill cues that we need to use to when we teach skills as well as to assess them. Okay. And put some concrete things you can pin your head, pin your instruction on. Okay.
So on the screen here, this is also located at the website, is under the resources tab. You can access the standards as well as these documents about how to really teach the standards. There's also some tools related down here, some PowerPoints and things that kind of walk you through how do you take a standard and use it to design a lesson so that you are really making sure that you're focusing on that skill. There are webinars out there on how to use these professional development tools. And Marlene and I do presentations everywhere on, there'll be one at Sophie if you're there this next Sophie season. But this is just a great, I hope you'll bookmark the schoolhealtheducation.org web site, because it's just a great plethora of information available for you.
Right. And we encourage you then to not only look at the standards and performance expectations within the standards, but please, please, please read the text because it's going to give you some tips, very concrete ideas about the teaching of each of the separate standards, and both within the National Consensus National Health Ed Standards document, as well as within the document, I changed the name of it. It's Teaching Standards-Based Health Education. And they're both free of charge. Download and share with your friends.
Yes. I can tell you this, if you are interested in learning how to use those professional development tools to help you design from standard-based instruction, you can go to Sophie's website and they have their core webinars, and there is an entire webinar on the standards dedicated to using those professional tools. So, or you can just contact Marlene or myself and we would love to help you through that process.
So one of the things that we really encourage novices to think about and is to use this planning template where you're starting with materials from the Centers for Disease Control and Prevention's Health Ed Curriculum Analysis tool. So we're starting with what behavior do we want students to do after we've identified a content area and a grade level. So what's the behavior, and using the HECAT to help you identify those, and then going down to what out of Standard 1, what are the performance expectations that you want to cover for that lesson, as well as, and then what skill. And notice I'm emphasizing the word skill. Sometimes you might sneak in a performance expectation from another standard, skill standard in, but sometimes, well, in my thinking, less is always more.
Yeah.
Sometimes we try to do too much. The only exception to that, for example, might be if we're looking at the decision-making standard, the goal-setting standard, or the advocacy standard, where, for example, in decision making, all of the steps of decision making are embedded within the performance expectations. And if you're going to do a full-blown lesson on advocacy, you really could use all of the performance expectations there as long as you've structured your lesson that way. And then finally, encouraging you to go to teaching standards-based health ed, because within that, that's where you can find the skill cues that we've, for each of those standards, as well as some suggestions and examples related to introducing, describing, modeling, and practicing and assessing a lesson.
So another thing that you'll find also at the website is there are samples that have been templates that have been filled in so that you can look at a completed product and know kind of what direction things were going. So we hope that it's very useful. With health and the design of the national standards, using that standard one for your foundational functional knowledge and then picking between what skill you want to work with. We know that when you're teaching sexuality or drug education or safety, I could teach decision making in all three of those units. Okay. Sometimes some skills lend themselves better than others for different content, but here's the deal. We know we're not getting K-12 health education. It's a reality. And so if we can focus on making sure that we are teaching these 7 skills every time we have the opportunity, surely if I've taught you decision making with 4 different units, maybe you'll have decision making is kind of what we're hoping for. But the most important takeaway, I think, really is use standards to guide your teaching. So many times people are out there, well, I could cover this. This looks like a great activity, and we just kind of have that unstructured approach. We have so little time to teach health that when we do have time, that when we do get time, we want to put the best quality product out there. And these standards really help us provide that foundation for quality health education. It gives us a clear framework of developmentally appropriate skill-based content that is consistent across grade levels, that has the scaffolding approach. I can remember when I got my first job and I walked into the classroom and they said, here's your book. And I had no standards. I didn't even have a curriculum. I just had a book. And it was just overwhelming. And then when I discovered standards, I went, oh, look, we could really be systematic about this. We could really have structure lessons that are both meaningful and measurable. And then, we've seen the standards as they have been revised, how they have evolved to meet the needs of the 20th century, first century learner. I mean, back in when I first started teaching, we didn't have technology, we didn't have cell phones, the need for health literacy wasn't as great, and social media wasn't even a thing. And so now what we've seen is this evolution of the standards where they're meeting the students where they're at. And if we're doing that, it becomes relevant to our students and therefore more impactful for them.
Right. And I want to reiterate Beth's statement. We can't teach every skill in every content area. We have to make some really absurd choices in health education because we just don't have the time. But so if we carefully determine which skills we're going to teach within each content area and make sure that across our content areas we've covered each of the skills at least 2, if not 3 times, we're going to get it. And we can trust that even though we don't teach decision making in a certain content area, and we can help students transfer that back into that content area when they're confronted with a health related decision because we've given them a solid foundation. So thinking rather than a mile wide and an inch deep, let's go maybe not a mile wide, much, let's maybe go by the dimensions of a volleyball court or something and go deeper.
Well, I
Okay.
appreciate all the information you just shared. And I also have to say, as you were chatting about it, like my heart was just feeling really, really happy because I was attempting to explain in a graduate level course recently that you have to really do that backwards design of what can I really do? My phrase that I say to them is sometimes you feel like you're shoving a gorilla into Spanx. And because there's so much we're trying to do, but we don't want to condense a gorilla's belly area. That's their large intestines, but we want to, that's why we have to scope and sequence. And the whole thing of being purposeful of, okay, yes, we can talk about so much about the dangers of vaping use, yet kids don't necessarily always think that's going to happen to them, especially the long term, the possible dangers. And
Mhm.
the skill part of how do I use a refusal skill or how do I make the best decision before I'm in the situation, that's so, to me, imperative. And I just love everything that you said. And it's so nice to talk to other professionals who truly care. And which one of my questions to you is you've been in the field for so long. Why do you care so much about these standards? I mean, it kind of shows, but I want to know more.
For
Well, like Beth, I didn't even I was handed a book that was 10 years old. I
Mhm.
had to start from scratch, and I'll be honest, I've been in the field so long that I actually went back to my school's library and found materials from the 67 school health education study because I was desperate. And so to be able then to be involved in developing standards and having a framework, and then seeing the Centers for Disease Control take our standards and performance indicators and turn that into the health ed curriculum analysis tool. Yeah, absolutely. I mean, that's just a dream.
yeah.
And so the things that I thought I needed as a beginning teacher are there now. We just got to show people where they are and help them find them and how to use them.
So, I always like to, as an instructional professor, and I'm mentoring future educators, I always tell them, you just let the standards guide you. They're not rules, they're not professional, they're a professional support.
Mhm.
And so for me, I love to see my teachers, my new teachers and my seasoned teachers. And another thing, what I am seeing is many of our community health educators are now having to step into this role, and they have not had the training that our teachers have. And
Mhm.
so they're even further out on the island on, I don't know what to do.
Yeah.
And so, watching them gain confidence as a professional health educator and realize they don't have to reinvent the wheel. I just need some parameters to help guide me through
Mhm.
so that I can empower my students. These standards are critical life skills for our students. And I think maybe that's where my passion lies, is if we can empower our students with these ability to make their own decisions, communicate their needs and their wants, self-manage their emotions. These are essential things they're going to use every day in their lives. And so, that making sure that I've equipped my students with those critical life skills, I think that's what really drives my boat, just seeing them be successful. I can remember going to a SHAC meeting, and they were talking about, oh, we can't talk about that, and you can imagine what curriculum it was of sexuality related. And I'm like, we are not promoting students to be sexually active. We are saying, here's the information that you need to make a good choice for yourself. We wouldn't deny students information about anything else. We're going to give them
Mhm.
the information, and then as health educator, our job is to say, here's how you evaluate that information. Here's how you
Yes.
look at its credibility. Here's how you look at your values and your and pros and cons and make a decision for yourself. And so that's what the standards do for me. They give those students that critical life skill support.
And it's so nice. This is where I say to people, if you haven't been able to go to a professional conference, either at the state level or the national level, go to one and find your people, because right here, it's another voice that says a lot of the same stuff I say,
Yeah.
to the future teachers, the current teachers and all. And I think, like myself, you're not doing a job. This is just who you are. It's your career, but it's who you are.
Mhm.
And before we end for today, is there anything else you'd like to say about the field, about the standards?
I am currently delving into the area advocacy. And, it's a huge competency for our CHES certification. And I also just want to make a plug for the standards are a powerful tool that can be used for advocating for comprehensive health education.
Mhm.
They provide common language for communicating with administrators and policymakers and parents about the importance of health ed. So you can use these national standards to advocate for stronger health education in your districts. And they kind of give you that credibility and the common language to speak with your decision makers. Because if we don't promote health, who is going to? We have got
Mm-hmm.
to be a bigger, louder, resounding gong to say, where we have a generation of children who are not able to self-regulate. We have a generation of children who are obese because they're not having enough health education. So we can use our standards as another tool in our toolbox to help move the cause of health education forward. Orlean, how about you?
Absolutely.
Well, since you brought it up, Beth, the whole advocacy and some of the things that young people do with standard
Mhm.
aid just blows me away. I mean, young people are tremendous advocates. If you watched what's happening here in Minnesota after a recent school shooting, those kids are out just demanding changes to protect themselves and their classmates and the people they love. And they're passionate, and it's really just heartwarming and moving to watch young people be such staunch advocates for their own health and their own safety. The other thing I've had the opportunity to participate in a meeting recently, and Beth was also involved. One message that's really important is that the Division of Adolescent and School Health at the CDC is still there. And there's some very competent people still working. And they are our agency. They have been for over 25, 30, well, more than that, 30, 35 years now that I think about it. They've been the agency leading the way and helping our professional organizations advance school health and school health education. And so I encourage you, show your support for CDC Dash by going in and using their resources. Go in and look up coordinated school health. Go in and look up whole,
The
the
HECAT.
WISC model.
Mm-hmm.
Go in and look up the HECAT. Go
Mhm.
in and look up the characteristics of effective health education curricula. Please go in and use those sites and use their materials. So, because we have some really wonderful professionals continuing to work really hard at the Centers for Disease Control Prevention.
Just a disclosure, there's no financial gain for us for you to do that. It's all
No,
about, it's just good,
no.
it's good quality health ed. Well,
Well,
thank you so much for the time. We enjoyed visiting with you and hope people get energized and
yeah.
just buy off on using those standards, the consensus
Yeah.
standard, using
And
those
if there's any
to
way,
make it.
Lori, with what you're doing or whatever, don't be afraid to contact me or Beth. I mean, Beth knows that I spend my mornings going to exercise and going to the pool. But this is my heart and soul, and this
Mm-hmm.
is where my passion is. And so this is the stuff I love doing. So,
I thank you so much for talking with me today. And actually, I'm about to record something for a grad class, so you have increased my energy level, because
yeah,
I love the discourse. I truly, truly do. And I appreciate connecting with other people who are passionate about being purposeful for what we do in the pre-K through 12 setting. So thank you so much. And we'll make sure that we have information for the both of you for people to get in contact if they'd like to. And for the listeners, I appreciate you listening in. Again, you can watch this on the YouTube channel and go to the schoolhealtheducators.org website. And then there's the schoolhealtheducation.org for the standards, the national consensus standards. But check those out and, please like things, tell others, promote it, advocate for our field. And also, thank you so much for doing what you do. The young people need us. So continue to be updated, continue to care. So thank you and have a great day.
Thanks.
Thank you.